Hello there. Let's talk about that really specific, really frustrating pain on the inside of your elbow. You know the one. It can make something as simple as picking up a coffee mug or shaking someone's hand a real challenge. We're going to unpack that together today. If you're already nodding your head, thinking about that familiar ache or maybe that sharp little twinge, I just want you to know you are definitely not alone. This is an incredibly common reason people come looking for help, and they're all hoping for the same things: to understand why it's happening and, of course, to find some relief.
Okay, so first things first, let's talk about the name, golfer's elbow. Honestly, it's a bit misleading. The vast majority of people who have this have never set foot on a golf course. It really has less to do with a specific sport and much more to do with an overload issue that can happen to just about anyone.
So if it's not actually about golf, what is your body trying to tell you with this pain signal? To really get to the heart of it, we have to look at how our understanding of this condition has really evolved over time.
This right here, this is a really important shift. For a long time, we called this epicondylitis. That itis ending means inflammation. So the thinking was, there's a fire in there, and we need to put it out. But, when scientists actually looked at the tissue, they didn't really find a fire. What they found was more of a structural change, which we call an Osis. The best way to picture it is to think of a rope. An itis is like the rope is on fire, but an osis, which is what's really happening, is more like that rope has become frayed from wear and tear. It needs support to heal, not just water to douse a flame.
And that's really the key. What we're dealing with is tendinosis. And this isn't just about medical terms. It's so important because it changes everything about our approach. We're not trying to constantly fight a fire in your elbow. We're trying to help a worn-down, frayed tissue heal and get stronger. It's a structural problem, not an inflammatory one. So which ropes are we talking about exactly? Well, as you can see here, it's usually these two tendons. They have some fancy names: Pronator Teres and Flexor Carpi Radialis, but their jobs are actually pretty simple. They help you do two main things: bend your wrist forward, kind of like you're revving a motorcycle, and turn your palm so it's facing the floor. Every time you grip something, or type, or lift, those tendons are on the job. So what causes all that fraying? Well, it's almost always about repetition. It's usually not one big injury, but thousands of little stresses that add up over time. Think about it. Forcefully gripping something, carrying a heavy bag, even something as simple as using a screwdriver for a weekend project. All these everyday activities can put a lot of strain on those specific tendons.
And it's also worth pointing out this age range. This issue tends to show up most often between ages 40 and 50. Now, this isn't because something suddenly breaks at age 40. It's really just a reflection of a lifetime of using our arms, of working and playing. It's a very normal and understandable part of having lived an active life.
And all of this brings us to the most important question of all, right? If we know we're dealing with a frayed rope instead of a fire, well, how do we help that rope heal? How do we help it get strong again?
The good news is the path forward is an active one. It starts with what we call relative rest. That doesn't mean you stop doing everything. It just means you pace yourself and become more mindful of the activities that really irritate it. Then we can slowly introduce very gentle, very specific exercises to help rebuild that tendon's capacity. And often, a simple support strap can work wonders to provide some relief while you go about your day.
And the research on this is becoming really clear. While an injection might quiet the pain for a little while, kind of like hitting the snooze button on an alarm, it doesn't fix the underlying problem. The evidence is pointing strongly towards targeted exercises for better, more lasting results. Why? Because you're actually rebuilding the strength of that frayed rope. You're creating a real, durable solution.
Okay, but what if you've been dealing with this for months or maybe even years? What if that feeling of hurt just seems to be stuck on no matter what you do? This is a really important question, and it gets us into some of the newer, fascinating science about pain. So I like to think of our nervous system as a super sophisticated alarm system. When you first get an injury, that system turns up its sensitivity dial to protect you. That's a good thing. But sometimes, even after the tissue has healed, the dial can get stuck in the high position. The alarm system stays on high alert. It's kind of like a car alarm that's so sensitive it doesn't just go off for a burglar, but for a single leaf landing on the hood.
This is really the heart of understanding persistent pain. Now, let me be clear. The pain you feel is always 100% real. But over time, it can become less about the actual state of the tissue and more about the sensitivity of that alarm system. This is where you can make a huge shift in your recovery. It's when you start to understand that hurt does not always equal harm. The best way to slowly turn that alarm sensitivity back down is often through slow, safe, gradual movement.
So if you take just one thing away from our chat today, please let it be this. Your body has an amazing, incredible capacity to heal and adapt. It's not broken. And that healing journey, it really starts with understanding what's truly going on inside.
And please, remember that you absolutely do not have to figure this all out on your own. The best first step you can take is to just have a conversation with a healthcare professional that you trust, a doctor, a physical therapist. They can work with you to create a plan that makes sense for your body and your life. Thank you so much for spending this time with me today.